Over psychotropic medications. They will cover, as I said earlier, briefly side effects on medications that you can see. It'll also talk to you about target behaviors these medications are trying to affect. Psychiatric medications. These are medications used to treat mental disorders, sometimes called psychotropic or psychotherapy medications, psychotherapeutic medications. They've changed the lives of many people with mental disorders for the better. Some people may be on these medications on short-term uses if they're having depression or anxiety. Other patients, people with bipolar, schizophrenia, they will be on these medications on a long-term basis, if not lifelong. Without these medications, a lot of people are unable to live a fulfilling life. They may suffer serious and disabling symptoms from the mental disorders that they are having to face. How do psychotropic medications work? Let's see. If you keep in mind that at birth we have 100 billion different neurons in our bodies. These neurons produce chemicals and electrical impulses that the body uses to communicate with itself. Neurotransmitters are chemicals which carry out communications between the neurons in the brain and throughout our bodies. How do these medications work? Well, these medications, they act on the brain and the central nervous system. They change the way chemicals in the brain, they're called the neurotransmitters, send their messages to each other through the synapses or crossings between the neurons. Each psychotropic medication is used to treat a certain target of symptoms. Some medications are used to treat neurotransmitters such as dopamine. Others may not work on dopamine, they'd work on serotonin, norepinephrine, so on and so forth. Where does these medications work? Well, as you can see over here, this is a typical part of it's very blurry, I apologize for that. This over here is what a typical nerve cell looks like. One end receives the message while the other end sends out a message to transmit throughout the body. A lot of the information, a lot of the medications for like schizophrenia and ADHD, they work on that reticular formation in the back of the brain stem there. And they're affecting how it reviews messages from the body. For instance, when someone is with ADHD, they have that reticulating system. It's going at 100 miles an hour, and so it'll send a stimulant to kind of speed it up, to get a rush to it, to allow it to burn itself out so it slows down and starts processing visual and mental things a little bit slower through it to help the body adjust and to slow down the child. Before they used stimulants, they used things such as sedatives such as the Klonopin and such like that on the child to sedate the brain and to kind of slow them down. Overlapping target symptoms, behaviors. As you can see here, and I do believe you have this slide here too, ADHD, what we want to target on that is anger, depression, impulsiveness, destructive, defiant behavior, their difficulty to focus. Well, that's the same thing with anger and depression that you'll also see in oppositional defiant, conduct disorder, anxiety disorder, bipolar. So some of these medications that they're on for bipolar will work for the ADHD, while others for anxiety may work for post-traumatic stress disorder. And it just gives you an idea of how some of these behaviors overlap through different diagnosis of mental disorders. Let's see here. So classes of psychotropic medication. There's different classes. We got the stimulants, we got the antidepressants, and these break down into different categories also. We have the mood stabilizers, the antipsychotics, and anti-anxiety medications. We'll discuss these and give examples of these medications. We'll also talk about the side effects of these medications, some of the more severe side effects of the medications, but it shouldn't take too long if you'll just bear with me. Stimulants. Stimulants are used to treat patients with ADHD. This is often a child who fidgets with their hands or squirms around in the seats. They often have difficulty playing or engaging in leisure activities quietly. They have to be going. They have to be running up and down the walls, bouncing off the walls. They're often known as the child that's on the go. They're driven by a motor. They have a short attention span, inability to stay still, the impulsiveness. Sometimes it's good, sometimes it's bad. They have destructive behavior at times, as you saw in that little overlapping targeting symptoms. Stimulants may be a short-acting or long-acting. They may take, if it's short-acting, they may take it twice a day. Long-acting, they usually take it once a day in the morning, and you don't want to give it to them too late after in the morning because it'll keep them up all night. Some children need to take a short-acting and not a long-acting stimulant and get coverage throughout the day just the same. Sometimes we only need the child to start focus mostly in the school, and once they get home they don't have to be as focused, so they may do the short-acting stimulant, and it starts to wear off once you guys get them back, and so you get to put up with the yelling and the screaming and the bouncing off the walls. But it's just whatever the doctor thinks is best for the child and what you guys decide upon. Examples of stimulants, you got the Adderall with Concerta, Ritalin, Dexatrin. Some of the medications, they come in different forms. Some medication comes in capsules, other comes in pill forms. Concerta comes in a little capsule that opens up in the body's stomach, and it releases the medication, and it's a shell. The shell doesn't get absorbed by the body. It gets taken out and to the toilet. Sometimes the child, mainly the little boys, won't flush the commode, and the mother or father walks in and they see the pill in the commode, and they kind of get concerned. Oh, there's the Concerta pill. Johnny didn't get his medication. It's not being absorbed. It is absorbed already. It's just the shell that gets pooped out. Some different examples there on ADHD medications. Possible side effects with these medications, most likely you're going to get headaches at the beginning. They're going to have weight loss. They're going to have jitters. They're going to have trouble sleeping. They may give them ADHD medication, and it creates a whole different problem for the child, and they have to give them something else to help them rest at night because it just wires them throughout the day and into the night. A lot of time they have that weight loss, the decreased appetite, and the child is not getting the appropriate nutrients. They will be measuring them at the doctor's office, of course, in their well-child checks. And if they're finding that the child's not gaining weight, losing weight, they're worried about the child being a failure to thrive at that point, where they're not getting the appropriate nutrients and nutrition that they need, and so the bones are not growing. Their bones develop with large pores in them and can break easily. And so those are some things that you watch for. They may develop tics instead of repetition in movements or sounds, not to be confused with tardive dyskinesia, which we'll talk about, which is like the eyes may wander back and forth. They may have a continuous worm-like movement of their tongue on the tardive dyskinesia, and if not caught soon enough, they may keep those for a lifetime, those little tics like that. Adverse reactions, sudden death in children with pre-existing heart conditions. Another good reason to have this information when you go to a doctor, if you don't know about congenital heart disease, if the doctor doesn't realize it either, prescribes these medications, the child goes home, takes the med, falls over at the playground, sudden death. High blood pressure can come along with these medications. It's because the stimulant will make the heart beat rapid and causing jitters and such like that. It will make the blood pressure rise. So they may not be able to take this medication. Problems with growing, such as a slower growth rate, as we talked about, the failure to thrive there. There's other medications like the Clonopin, Catapris is another name of it, used to treat high blood pressures. They use that also to sedate the child with ADHD. They use it at a lot smaller doses. Strattera, that's a non-stimulant drug that helps out. Wellbutrin, that's an SSRI, I do believe. Oh, Tofranil, that there is a tricyclic, and it works also, it has an adverse reaction on the heart. So when a child goes on Tofranil, he could be on it for ADHD, may be on it for bedwetting. It helps with that at night. It'll change the electricity of the heart in some children, so it may give them an arrhythmia. So before starting on that, they give them a EKG, and then every 6 months they bring them back in with an EKG to make sure the child isn't developing an abnormal heart rhythm. Stimulants are usually used, usually the first medications tried for the ADHD. Sometimes antidepressants are given with ADHD if 2 or 3 different stimulants tried have not worked. Your doctor should start the stimulant on a lower dose and then increase it as needed. A short-acting stimulant should last about 4 hours, and then long-acting are usually in the body for 8 to 12. And of course, as the longer the child takes the medication, the more their body gets used to it. So what may be 14 hours the first day, by the end of the week, it's only staying in their body about 10 hours by then. So keep in mind. All of these stimulants, they work on the central nervous system. Its general action of the stimulants is to produce the stimulation on the CNS by increasing the levels of neurotransmitters in the CNS, the central nervous system, causing a mental alertness and attention span in children. The stimulants help the brain enhance its ability to filter out distractions. Just to keep in mind, abrupts on these stimulant medications, abruptly stopping a medication is not always a good thing. It could cause fatigue and mental depression on the child. Avoid taking extra caffeine, so if the child has a craving for Mountain Dew and they're on Adderall, they probably shouldn't do so. It'd make them even more hyper. Long-term use of Ritalin can slow the child's growth. So tell the doctor if you're noticing anything about problems with weight gain with the Ritalin. Usually they don't give Ritalin to children younger than 6 years of age, so make sure if you have a small child that the doctor's prescribing the Ritalin to, you talk to them about it. Ritalin is a medication that has a severe life-threatening reaction to a MAOI inhibitor, which is an antidepressant. So it's good to keep in mind the medications that can and cannot be taken. There's some of these medicines. Antidepressants. Everybody has depression a time or two. Depression in children, you'll probably see this a lot. With children being taken from their homes or being switched from care from home to home. They get a little depressed. They have these vague, non-specific complaints such as headaches, muscle aches, stomach aches. They may have outbursts of shouting, complaining, unexplained irritability, or crying. They just break out in tears. Increased irritability, anger, or hostility. They can develop any of those as signs of depression. They have thoughts of suicides. Antidepressants may help with other conditions such as school phobias, panic attacks. Those are more on the lines of anxiety disorders. They may prescribe them for autism and ADHD and the bedwetting, the tofranil, as we talked about earlier. Sometimes with OCD and PTSD. Antidepressants are usually prescribed. Different classes of antidepressants. You have the SSRIs, the selective serotonin reuptake inhibitors. They're often used to treat depression in children because they're safer than a lot of the older drugs, such as the MAOIs and the tricyclics. Example of an SSRI would be Celexa, Lexapro, Prozac, Zoloft, Paxil. Possible side effects with an SSRI, we're looking at headaches, which are some of the signs of depression, nausea, stomach upset, dry mouth. A lot of times taking these medications, at the beginning the child gets dry mouth, cotton mouth. If you carry some hard candy, it's helpful for the child. Encourage them to take frequent sips of water. That should go away within the first week, usually. And with SSRIs, they take anywhere from 2 to 4 weeks to get into the body system. So keep that in mind. They may not be over the depression immediately. They can cause irritability, changes in weight, trouble sleeping. The caregivers of children taking SSRI should monitor for depression getting worse. And that thoughts of suicides may be getting worse. If this happens, immediately talk to your doctor. SNRIs, those are serotonin norepinephrine reuptake medications. They're usually prescribed when SSRIs do not work. That would be the Adfixor, the Cymbalta, the Prestige. These medications are also prescribed, the Adfixor and Cymbalta are also prescribed in patients who are having problems with general pain, such as fibromyalgia. They'll generally prescribe these medications also for that. Side effects of SNRIs: abnormal dreams, nervousness, body weakness, the chills, the coughs. You can have high blood pressure with it also. Of course, the adverse reactions, panic attacks, hallucinations, that's pretty severe there, and increased thoughts of suicide. Atypical antidepressants. Children who are traumatized may have problems with sleep. Atypical antidepressants are more often used to help the children with sleep disorders. These medications are usually safer in children than standard prescription for sleep medications such as Ambien. They may use Distoril, Robutril, and Remeron. And then side effects with these medications, a lot of them are the same: the headaches, the dry mouth, the nausea. A lot of times you'll have constipation with these medications. Seizures, low white blood cell counts can happen with some of these medications, and so the child is prone to more infections. Medications may take a couple of weeks to work. A 2-week break may be needed after finishing one medication before starting another, just so you know that the medication's out of the system. If it takes 2 weeks to get in, it takes 2 weeks to get back out. A child should never stop taking it abruptly. Doctor will help you wean the child off Sometimes they may say, well, they're at a low enough dose of the Prozac, we don't worry about it. Let's just stop that and start on Lexapro. Sometimes they want to wean them down and take them off of it slowly.
When you went off and started, I know that you usually take a break, but do they ever do that, or then during those 2 weeks, whether because then it'd be like a month down?
Yeah, a month before you get into it. Yeah, they depending on the medication and whether or not they feel, like I said, like Prozac and Lexapro, they're both SSRIs, and sometimes they'll just stop one of the SSRIs and start you immediately on another to see if it works for you. And if they're going to go from an SSRI to tricyclic, they may at that time take a 2-week break. But when they do that, those older medications don't take as long to get into the body and work. And so sometimes you won't have to worry about having to see those symptoms for a full month before it starts to take effect. MAOIs and tyramines. This is an enzyme that's contained in food. It's in aged cheese, American cheese, avocados. When the child, and it goes on through there, when the child takes an MAOI, and hopefully they won't, and they end up taking these medications and they end up getting this enzyme in their body, they are at risk for a dangerous side effect or an adverse reaction known as hypertensive crisis. They may develop symptoms of chest pain, severe headache, nausea, vomiting, photosensitivity, enlarged pupils. At that time, it is an emergency, a medical emergency, and you need to call 911 and get the kid to a doctor. But MAOIs are not prescribed as much anymore unless you find an old psychiatrist that doesn't like to come into the 21st century there. Those were the medications that came about in the 1970s, and there's been a lot of changes in the field since then. Any questions on antidepressants? Keep in mind with antipsychotics and antidepressants, you may develop photosensitivity just as a side effect of these medicines. And when the child goes out in the summertime with short sleeves and shorts, they may get a severe sunburn just because they're more sensitive and more subjected to the UV rays there. So having them put on sunblock while they're on this medication, wearing long sleeves or a big brim hat doesn't hurt. Let me catch up here. All right, antipsychotics. These are the medications that will be used to treat bipolar, schizophrenia, Tourette's syndrome. They can be used to treat severe aggression in a child. When a child is said to be in psychosis, that involves the overstimulation of the reticulating activating system, the RAS. Antipsychotic medications block dopamine and serotonin receptors in the brain, helping to depress the RAS. You have atypical and typical medications. The typical medications came out in the 1950s. That's what you hear, lithium. That would be a typical medication. Atypical medications are the second generations of the antipsychotics. They usually work a lot better in a patient, but they still use the typical with the atypical, sometimes both at the same time. Examples of second generation, the atypicals, we're looking at Seroquel, Zyprexa, Risperdal, Geodome, Abilify. Sometimes with these atypical medications, they cause movement disorders, such as shuffling the feet, tongue sticking out, mouth drooling. I've seen, I used to be a corrections officer at a mental health facility before I became a nurse up in Kansas. And I've seen a lot of people who have what they call tardive dyskinesia. And what that is a side effect that comes along with atypical, what they're describing here with the tongue sticking out and such like that, their eyes moving back and forth. If you start to notice these things, a child starting to shuffle their feet, they may be rocking themselves back and forth in the chair. These tardive dyskinesia, they're a lifelong side effect. So if you don't stop the medication in time, they'll be doing that worm-like movement with their tongue throughout their life until they're dead. It won't go away. Their eyes may wander back and forth until they die. These tardive dyskinesia is a serious side effect of these medications, and so if you see certain tics like that, don't be afraid to call the doctor, tell them what's going on, and let them know. Because the sooner you stop the medication that they're on that's doing it, the better chance they have of not keeping these little tics for the rest of their life. Black box warning, Abilify and Seroquel, they have what they call a black box warning. They're not approved for depression for the ages of children under the age of 18 due to the increased risk of suicide thinking. I think they've actually increased that now, back in 2007, to the age of 24. They don't want to prescribe that medication to anyone 24 and younger due to the suicidal thinking and behaviors in the short-term studies that were used in children. Black box warning for clonazepam. Clonazepam can cause myocarditis, a heart condition. It can cause seizures, risk for life-threatening agranulosis. That's where the white blood cells get so low that you're prone to pick up diseases. Can't fight them off. They have adverse cardiovascular and respiratory effects on the body. Possible side effects of atypical antipsychotics, we're looking at sleepiness, they're tired, have trouble staying awake, the constipation, the dry mouth, the blurred vision. Less common side effects, dystonia, where you have muscle spasms, stiff neck, the tongue sticking in and out of the mouth. You can have the rigid movement, the drooling, the tremors, the restlessness, unable to sit still. Here it goes into more detail about the tardive dyskinesia, as I had spoke of earlier. It talks about metabolic syndrome, where you gain a lot of weight, you become, your blood sugar gets high and your blood pressure gets high. And so you're at risk for heart disease because of that. The neuroleptic malignant syndrome, where extreme muscle stiffness, high fever, sweating, tremors, confusion, unstable blood pressure, and heart rate. All these are an emergency situation, should be notified. The doctor should be notified immediately. Feel free to jump in and ask questions if you do have any. Typical antipsychotics are used less often in children. They're the Haldol, the Thorazine, the lithium. These medications, some of these medications need to have a therapeutic range, so that's when the blood work come in. Each child is different, so the child may need to try different medications in order to find the right one that works. You should start seeing positive effects with typical antipsychotics within 2 to 3 weeks. It may take up to 6 to 8 weeks. Child should never start taking them, as we said before. May cause fast changes in mood, moods with agitation and aggression. And again, the child's weight, glucose levels, and lipid levels should be monitored on regular doctor's visits, like every 6 months. And that is for the antipsychotics. Then we go into mood stabilizers. Mood stabilizers are used to treat children with mood disorders, also known as bipolar disorder. They used to call it manic disorder also. They use, a lot of times they'll use mood stabilizers along with antipsychotics and antidepressants to treat bipolar disorder. Mood stabilizers are used usually first, and then they try to incorporate other meds. They may also try to use anticonvulsant medications such as Depakote, Tegretol, Lactamil. Those are medications that they may also try to use in bipolar disorder if the mood stabilizers are not working. Talking about the manic state, when the child is in the manic state, they're very active, they talk too much, they have a lot of energy, they sleep very little, they may also be angry and irritable. The stages of mania with the stages of depression, they cycle. They may be in a manic state for 3 weeks out of the month, and then they go into this depressive stage where they're very suicidal and you have to watch them. This is what the mood stabilizers are hopefully going to change. They may not work on the depression like it does on the mania, so they may end up taking another medication like an antidepressant to help with the cycles there. Sometimes medications used to treat mood disorders are also used for the seizure disorders, as I talked about there earlier. Put through there. Possible side effects and adverse reactions of Lamictal. You have dizziness, problems sleeping, drowsiness, vomiting, constipation. The more serious side effects are skin rashes, Stevens-Johnson syndrome. Stevens-Johnson syndrome is a rare but serious condition. It affects the skin and the mucosas. It's where you got a buildup of a chemical in your body that can cause hives and blisters, and your skin can shed off. It looks like you have second-degree burns being caused by the chemical on the inside of the body. It is a medical emergency. A lot of times these children and adults who have this Stevens-Johnson syndrome, they go to burn units to be treated. Depakote, another anticonvulsant. Some of the side effects, hair loss. So, weight changes, constipation. It could be toxic on the liver, and cause liver failure, which is rare but very serious, of course. No need to be 18 and on a liver transplant. So that's the reason why the doctors will bring them in to take samples every 6 months to a year to make sure they're therapeutic. Tegretol, some of the more severe reactions would be blood cell production in the bone marrow. You'll have a reduction there, the decreased red blood cell, so the hemoglobin will be low, and you'll have low platelets, so they may end up having trouble stopping the bleeding if they get cut on their arm. And then the Stevens-Johnson syndrome again. Lithium. Lithium's pretty bad stuff from the 50s. You can develop problems urinating. A child may start on lithium and can't urinate the whole day, and if you're not paying attention, the bladder can swell up, and they're having problems from the waist down with movement of the body, and hopefully it's caught before bladder bursts and they have to go into a urostomy. Some signs of the toxicity of lithium is repeated vomiting and diarrhea. severe tremors, difficulty walking, unable to walk, and that would probably go back to the inability to urinate. Poor coordination, extreme sleepiness, slurred speech, blurred vision, ringing in the ears, tinnitus, seizures, muscle twitching. And of course, again, you'll be doing that regular blood work to determine if the blood level of lithium is safe and in the effective range, or if it's too high and getting toxic. Mood stabilizers may affect the metabolism of the liver, the kidneys, and the thyroid. So don't be surprised if you see thyroid levels being drawn on the child, and LFTs, the liver functioning test. Anti-anxiety medication. They use several different types of medication to help with general anxiety disorders. They can use benzodiazepines, which work immediately, which are enhanced the properties by the properties of alcohol. We're looking at Klonopin, Ativan, and Xanax. You shouldn't take those and go out and party. Hopefully the child won't be doing that. They do run the risk of becoming addictive if you take them over a long period of time. So usually what will happen is the doctor will start you out on, say, Xanax and give you some Paxil to work on the general anxiety disorder, social anxiety disorder, and he'll only give about a week to 2 weeks of the benzodiazepine so that it lowers the risk of addiction. Usually they only give 1 to 2 weeks, and then they require you to come back for another prescription if need is arising for it. Other anti-anxiety medications that's not listed here are stuff like beta blockers. Sometimes they give you Inderal that'll help you with anxiety. And then the summary here. The vast majority of children in the DFPS conservatorship do not need psychotropic medication. Some children need psychotropic medications to get relief from temporary symptoms. They'll come on and off of them and hopefully not have to use them in a long-term scenario. Psychotropic medications alone are not the best treatments. They should always be used with non-pharmacological interventions. The caregiver and medical consenter has the responsibility to monitor the child and make sure the medication is working and helping, and to talk to the doctor about side effects and adverse reactions, or whether or not they're seeing the benefit of the medication. CPS staff and caregivers and medical consenters should contact Star Healthcare if they believe the child is in need of a review of those medications and believe the child is taking medications outside the parameters there. Any questions? I appreciate you guys listening to me. I know it's a very dry subject.